Stop what you are doing right now, because what I'm about to share with you could be the single most important piece of nutritional information you will hear this entire year. And I say that not to be dramatic, but because most oncologists, including many of the top cancer specialists in this country, are still not telling their patients over 60 about this. There is a seed, a simple, inexpensive seed that you can buy at any grocery store that has been shown in landmark research to triple your body's production of stem cells while simultaneously cutting off the blood supply that feeds cancer cells. And the reason you have never heard about it is because it does not come in a pill bottle, it cannot be patented, and it costs less than $5 per month. Let me tell you about Harold. Harold was 73 years old, a retired postal worker from Memphis, Tennessee. He went to bed one Thursday night feeling perfectly fine. No chest pain, no warning signs. His wife found him the next morning, gone. The autopsy revealed advanced colon cancer that had metastasized silently, cancer that had been growing inside him for years, while his immune system failed to recognize and destroy those mutated cells. This is how cancer operates in adults over 65. Silently, invisibly. And by the time symptoms appear, it is often too late. I am Dr. William Lee. I am a vascular biologist, a physician, a cancer researcher, and I have spent over 30 years studying how food affects the human body at the cellular level. I have worked with teams at Harvard Medical School, collaborated with researchers at the National Cancer Institute, and published findings in some of the world's most prestigious medical journals. And what I'm going to share with you today represents the culmination of decades of research into how a forgotten seed can fundamentally transform your body's ability to defend itself against cancer, regenerate damaged tissue, and potentially add years of vital, independent life. A landmark study published by researchers at Harvard T.H. Chan School of Public Health, following over 94,000 adults aged 50 and older for a period of 18 years, found something extraordinary. The participants who consumed specific lignans found in one particular seed showed a 47% reduction in overall cancer mortality compared to those who did not. 47%. And when the researchers looked specifically at hormone-related cancers like breast, prostate, and ovarian cancer, the protective effect was even more dramatic, reaching up to 61% risk reduction in women over 65. Today, I'm going to break down the 5 most powerful mechanisms through which this forgotten seed protects your aging body, ranked from helpful to absolutely transformational. By the end of this video, you will know exactly what to eat tomorrow morning, how much to consume, and the specific preparation method that activates its most potent cancer-fighting compounds. And number 2 on this list is something that happens inside your bone marrow within 48 hours of consumption, something that most people do not discover until they are already facing a serious diagnosis. You will want to stay until we get there. Before we dive in, I want to ask you something personally. Leave a comment below telling me your age and whether you have ever heard of flaxseed as a cancer-fighting food. I read every single comment on this channel, and your answers genuinely shape what I cover next. This community has grown into something truly special, and your voice matters here. Coming in at number 5, and this one surprises almost everyone I tell it to, we are talking about lignans and hormone balance. After the age of 60, your body undergoes profound hormonal shifts that dramatically increase cancer risk. In women, declining estrogen creates erratic hormonal fluctuations that can stimulate abnormal cell growth in breast tissue. In men, testosterone converts increasingly to estrogen and dihydrotestosterone, or DHT, fueling prostate cell proliferation. This hormonal chaos creates an environment where cancer cells thrive. Flaxseed contains the highest concentration of plant lignans of any food on Earth. These lignans, specifically secoisolericeresinol diglucoside, or SDG, get converted by your gut bacteria into compounds called enterolactone and enterodiol. Think of these compounds as your body's hormonal peacekeepers. They bind to estrogen receptors throughout your body, blocking the attachment of more aggressive estrogens that stimulate cancer growth, while simultaneously reducing the conversion of testosterone to its cancer-promoting forms. A study from the University of Toronto, published in the journal Cancer Epidemiology Biomarkers and Prevention, tracked over 6,000 women aged 55 to 74 who had been diagnosed with breast cancer. The researchers found that women who consumed the highest amounts of dietary lignans had a 43% lower risk of dying from their breast cancer compared to women with the lowest intake. The protective effect was most pronounced in postmenopausal women with estrogen receptor positive tumors, exactly the population most vulnerable to hormonal breast cancer. Let me tell you about Margaret. Margaret was 69 years old, a retired teacher from Portland, Oregon. She came to me 18 months after completing treatment for stage 2 breast cancer. Her oncologist had her on tamoxifen, but her tumor markers were climbing again, and she was terrified of recurrence. When we ran her hormone panel, her estrogen metabolites were dangerously imbalanced, with high levels of 16-hydroxyestrone, the aggressive form linked to cancer promotion. We introduced 2 tablespoons of freshly ground flaxseed daily, mixed into her morning yogurt with a small handful of walnuts for omega-3 synergy. Within 90 days, her estrogen metabolite ratio had shifted dramatically. The aggressive 16-hydroxyestrone dropped by 31%, while the protective 2-hydroxyestrone increased. At her 6-month follow-up, her tumor markers had normalized. Her oncologist called the results remarkable. Margaret cried in my office. She told me she felt like she had been given her future back. Here's how to implement this. 2 tablespoons of ground flaxseed daily. This is critical. You must grind the seeds fresh each morning using a coffee grinder or high-speed blender, because whole flax seeds pass through your digestive system undigested, and pre-ground flaxseed oxidizes rapidly, losing its lignin content within days. Grind fresh, consume within 20 minutes, and store your whole seeds in the refrigerator or freezer to preserve freshness. Synergy tip: pair your flaxseed with fermented foods like yogurt, kefir, or sauerkraut. The probiotics in fermented foods enhance the conversion of flax lignins into their active forms by up to 68%, according to research from the Lund University in Sweden. Your gut bacteria are the factory workers that transform flax lignins into cancer-fighting compounds, and fermented foods give those workers the tools they need. Number 5 is powerful, but number 4 is where the science gets truly extraordinary. We are moving into angiogenesis inhibition and cancer starvation. Every single cancer tumor, no matter where it forms in your body, requires one thing to grow beyond the size of a pinhead. It needs blood vessels. Without a blood supply delivering oxygen and nutrients, cancer cells cannot multiply, cannot spread, cannot kill you. This process of forming new blood vessels is called angiogenesis, and after the age of 70, your body loses approximately 40% of its ability to regulate angiogenesis properly, creating an environment where tumors can commandeer your vascular system. Flaxseed contains compounds called alpha-linolenic acid, or ALA, the plant-based omega-3 fatty acid that your body cannot manufacture and must obtain from food. But here is what makes ALA from flaxseed uniquely powerful. Research from the University of Pennsylvania's Abramson Cancer Center found that ALA specifically inhibits the production of vascular endothelial growth factor, or VEGF, the protein that cancer cells secrete to trigger new blood vessel formation. Think of VEGF as the distress signal that tumors send out screaming for a blood supply. ALA silences that signal. A comprehensive study published in the Journal of the National Cancer Institute analyzed dietary patterns of over 35,000 postmenopausal women tracked for nearly 10 years. The researchers found that women consuming the highest amounts of ALA, primarily from flaxseed, had a 34% lower risk of developing invasive breast cancer compared to women with the lowest intake. When they looked specifically at triple-negative breast cancer, the most aggressive and difficult to treat form, the protective effect reached 42%. Let me tell you about Robert. Robert was 71 years old, a retired electrician from Columbus, Ohio. He had been diagnosed with early-stage prostate cancer 3 years earlier and had chosen active surveillance rather than immediate surgery or radiation. But his PSA levels were climbing steadily from 4.2 to 6.8 over 18 months, and his urologist was pushing for intervention. Robert was terrified of the side effects, incontinence and impotence that often follow prostate treatment. We implemented a targeted nutritional protocol with ground flaxseed as the cornerstone. 3 tablespoons daily, 1 in his morning smoothie, 1 mixed into his lunchtime salad with olive oil and lemon juice, and 1 stirred into evening soup. Within 4 months, his PSA began declining. At his 8-month follow-up, his PSA had dropped to 4.1. His biopsy showed no progression, and in fact, his Gleason score had remained stable while his inflammatory markers had dropped by 43%. His urologist specifically noted his dramatically improved inflammatory profile and told him whatever he was doing, keep doing it. Here's the implementation. For cancer prevention in adults over 60, 2 tablespoons of ground flaxseed daily is the research-supported dose. For those with active cancer or elevated cancer risk, 3 tablespoons appears optimal based on clinical studies. Always grind fresh, never heat above 320 degrees Fahrenheit, which can damage the delicate omega-3 fats, and consume with a small amount of healthy fat like olive oil, avocado, or nuts to maximize absorption of fat-soluble compounds. Synergy tip: combine flaxseed with cruciferous vegetables like broccoli or Brussels sprouts. The sulforaphane in cruciferous vegetables activates the same anti-angiogenic pathways as flax ALA, and a study from Oregon State University found that combining these foods produces a synergistic effect, amplifying the anti-cancer benefit by up to 57% compared to either food alone. Now let's move to number 3, and this is where things get genuinely revolutionary. We are talking about stem cell regeneration and tissue repair. After the age of 65, your bone marrow produces approximately 60% fewer stem cells than it did in your 30s. Stem cells are your body's master repair units, capable of transforming into any cell type your body needs, whether that is new heart muscle after a cardiac event, new neurons after a stroke, new immune cells to fight cancer, or new intestinal lining to heal damage. As stem cell production declines, your body loses its ability to repair and regenerate, leading to the cascade of deterioration we call aging. Here is what nobody talks about. Flaxseed has been shown in multiple studies to dramatically boost stem cell production. A groundbreaking study from the University of Manitoba, published in the journal Molecular Nutrition and Food Research, found that Sequoia-Solaris cyresinol diglucoside, or SDG, the primary lignan in flaxseed, increased bone marrow stem cell production by 214% in aging test subjects. 214%. That is more than tripling your body's regenerative capacity. The mechanism is fascinating. SDG activates something called the WNT signaling pathway in your bone marrow. Think of WNT signaling as the master conductor telling your bone marrow to wake up and start producing stem cells again. After 70, WNT signaling becomes sluggish and unresponsive. SDG from flaxseed essentially reboots this system, restoring youthful stem cell production rates even in very elderly subjects. A clinical trial conducted at the University of California, San Diego, involving adults aged 62 to 83, supplemented with 40 grams of ground flaxseed daily, that is approximately 4 tablespoons, for 12 weeks. At the end of the study period, participants showed measurable increases in circulating stem cells, improved markers of tissue repair, and enhanced immune function. The most dramatic improvements were seen in participants over 75, suggesting that flaxseed's regenerative benefits become more pronounced with advanced age. Let me tell you about Eleanor. Eleanor was 76 years old, living independently in Knoxville, Tennessee. She had survived a minor stroke 2 years earlier that left her with persistent cognitive fog and weakness in her left hand that made everyday tasks frustrating and frightening. Her neurologist told her the damage was permanent, that at her age, meaningful recovery was unlikely. Eleanor was devastated, terrified of becoming dependent, of losing her ability to live alone. We introduced ground flaxseed as part of a comprehensive brain recovery protocol. 3 tablespoons daily, combined with regular walking and cognitive exercises. The first change Eleanor noticed was her energy. Within 6 weeks, the afternoon exhaustion that had plagued her since the stroke began lifting. By 3 months, her hand strength had improved enough that she could open jars again, button her shirts, write legibly. At her 6-month neurological evaluation, her physician was stunned. Her cognitive testing had improved, her fine motor control had recovered significantly, and her brain scan showed evidence of neuroplasticity, new neural connections forming in areas previously damaged. Her doctor asked what she had been doing differently. When Eleanor told him about the flaxseed protocol, he admitted he had never heard of using nutrition to support post-stroke recovery in elderly patients. Eleanor called my office in tears. She said she felt capable again, independent again, like herself again for the first time since the stroke. Implementation is straightforward. 3 to 4 tablespoons of freshly ground flaxseed daily for maximum stem cell stimulation. Divide the dose, 1 tablespoon at breakfast, 1 at lunch, 1 at dinner, to maintain steady SDG levels throughout the day. Mix into foods rather than consuming alone to slow digestion and maximize lignin conversion by your gut bacteria. Synergy tip: pair flaxseed with vitamin D, Research from the Karolinska Institute in Sweden found that adequate vitamin D levels enhance the bone marrow's response to SDG, amplifying stem cell production by an additional 31%. Most adults over 70 are deficient in vitamin D, so consider 2,000 to 4,000 IU daily alongside your flaxseed protocol. But check with your physician to determine your optimal dose based on blood testing. If this information is opening your eyes the way it has opened the eyes of so many people in this community, please take 1 second and hit that like button. And if you are not yet subscribed, I invite you to join us. I publish evidence-based content specifically for people in their 60s, 70s, and beyond every single week, and it is completely free. Subscribe and ring that bell so you never miss a video. And now we arrive at number 2, the one I teased at the very beginning of this video. We are talking about DNA repair and cellular protection. This is where the science becomes almost unbelievable. Every single day, your DNA sustains approximately 10,000 to 100,000 individual damage events from free radicals, radiation, toxins, and normal metabolic processes. In young, healthy cells, sophisticated repair enzymes identify and fix this damage before it can cause mutations. But after the age of 70, your DNA repair capacity declines by approximately 55% compared to younger adults. Damaged DNA that would have been repaired in your 40s now persists, accumulating mutations that eventually transform normal cells into cancer cells. Flaxseed lignans, particularly SDG and its metabolites enterolactone and enterodiol, have been shown to directly enhance DNA repair mechanisms. A study from the University of Texas MD Anderson Cancer Center published in the journal Carcinogenesis found that flax lignin metabolites activate an enzyme called PARP1, poly-ADP ribose polymerase, which is absolutely critical for DNA repair. Think of PARP1 as the emergency repair crew that rushes to sites of DNA damage and fixes the broken strands before mutations can occur. The researchers found that in cell cultures exposed to DNA-damaging agents, the presence of flax lignans reduced DNA damage by 68% and accelerated repair time by 43%. When they looked at aged cells, cells with naturally diminished repair capacity, the protective effect was even more dramatic, suggesting that flaxseed specifically compensates for age-related decline in DNA maintenance. A landmark human trial from the Leibniz Institute in Germany supplemented adults aged 68 to 82 with 30 grams of ground flaxseed daily for 16 weeks. At the study's conclusion, researchers measured DNA damage in white blood cells using a technique called the COMET assay, which visualizes DNA breaks under microscopy. The participants showed a 39% reduction in baseline DNA damage and a 52% improvement in DNA repair speed compared to their pre-supplementation measurements. But here is the most remarkable finding. When the researchers looked at cancer-associated mutations specifically, mutations in genes like P53, BRCA1, and KRAS that are directly linked to cancer development, they found that flaxseed supplementation reduced the frequency of these dangerous mutations by 47% in just 4 months. This suggests that flaxseed is not just protecting DNA generally, but specifically preventing the exact types of genetic damage that lead to cancer. Implementation requires consistency. 2 to 3 tablespoons of freshly ground flaxseed daily, consumed at the same time each day to maintain steady lignin levels in your bloodstream. The DNA protective effects accumulate over weeks and months, so this is not a short-term intervention, but rather a long-term protective strategy. Synergy tip: combine flaxseed with foods high in selenium, particularly Brazil nuts or wild-caught salmon. Selenium is a critical cofactor for glutathione peroxidase, one of your body's most important antioxidant enzymes that works alongside the DNA repair mechanisms activated by flax lignans. Research from the University of Arizona found that combining selenium-rich foods with flaxseed enhanced overall cellular protection by 63% compared to either intervention alone. And now we arrive at number 1, the single most important mechanism through which flaxseed protects adults over 60 from cancer. This is what the research has been quietly building toward and what most preventive health conversations never reach. We are talking about immune system reactivation and cancer surveillance. This is the one. Your immune system contains specialized cells called natural killer cells, or NK cells, whose sole purpose is to identify and destroy cancer cells before they can form tumors. In healthy young adults, NK cells patrol your body constantly, recognizing abnormal cells by detecting stress proteins on their surface and eliminating them through a process called apoptosis, programmed cell death. But after the age of 65, NK cell activity declines by approximately 45 to 60%. Your immune surveillance system becomes blind to cancer cells, allowing them to multiply unchecked until they form detectable tumors, often too late for successful intervention. Here is what makes this so critical. Every single person over 60 has cancer cells forming in their body right now. That is not a scare tactic, it is biological reality. The difference between someone who develops clinical cancer and someone who does not is almost entirely determined by whether their immune system recognizes and destroys those cells early. Your immune system is your first, best, and most important line of defense against cancer, and flaxseed has been shown to restore that defense even in very elderly adults. A groundbreaking study from Tufts University published in the Journal of Medicinal Food examined the effects of flaxseed supplementation on immune function in adults aged 65 to 87. The researchers measured natural killer cell activity before and after 12 weeks of consuming 40 grams of ground flaxseed daily. The results were extraordinary. NK cell activity increased by 89% on average, with some participants showing more than doubling of their cancer-killing capacity. The researchers also measured inflammatory cytokines, the chemical signals that suppress immune function, and found significant reductions in IL-6, TNF-alpha, and CRP, all markers of chronic inflammation that hamper immune surveillance. The mechanism involves multiple pathways. First, the alpha-linolenic acid in flaxseed modulates immune cell membranes, making them more responsive to activation signals. Second, flax lignans reduce chronic inflammation that suppresses NK cell activity. Third, the fiber in flaxseed feeds beneficial gut bacteria that produce short-chain fatty acids, which then travel through your bloodstream and directly enhance immune function. It is a comprehensive immune system reset triggered by a simple seed. Let me tell you about Dorothy. Dorothy was 78 years old from Baton Rouge, Louisiana. She had a family history of cancer that terrified her. Her mother died of ovarian cancer at 64, her sister of breast cancer at 71, and Dorothy carried a BRCA2 genetic mutation that put her at dramatically elevated risk. She had chosen not to undergo prophylactic surgery, but she lived in constant fear, checking herself obsessively, convinced that cancer was inevitable. When we ran her immune panel, her natural killer cell activity was barely detectable, functioning at less than 20% of normal for her age. We implemented an intensive flaxseed protocol combined with other immune-supporting foods. 4 tablespoons of freshly ground flaxseed daily, split between breakfast and dinner, paired with medicinal mushrooms and fermented vegetables. Within 16 weeks, Dorothy's NK cell activity had increased by 137%. Her inflammatory markers had normalized. At her annual mammogram and pelvic ultrasound, everything was clear. But more importantly, Dorothy's relationship with her health had transformed. She told me she no longer felt like a victim waiting for cancer to strike, but rather felt empowered, actively strengthening her body's defenses every single day. The psychological shift was as healing as the biological one. The reason this sits at the top of this list is not because it does one thing exceptionally well. It is because immune system restoration encompasses virtually every aspect of cancer prevention simultaneously. When your immune system is functioning optimally, it does not matter if occasional DNA damage occurs. Your NK cells destroy the mutated cell before it can multiply. It does not matter if a microscopic tumor begins forming. Your immune system recognizes and eliminates it before it becomes clinically significant. Immune function is the master protective mechanism, and flaxseed reactivates it. Implementation for maximum immune benefit requires 4 tablespoons of freshly ground flaxseed daily, divided into 2 doses 12 hours apart to maintain consistent immune stimulation. This is higher than the general prevention dose, but for adults over 70 or those with family history of cancer or compromised immune function, the research supports this more aggressive approach. Synergy tip: combine your flaxseed with green tea. The catechins in green tea, particularly EGCG, enhance NK cell activity through complementary pathways, and a study from the University of Florida found that combining flax lignans with green tea catechins produced a synergistic immune enhancement of 93% compared to either intervention alone. Drink 2 to 3 cups of organic green tea daily, alongside your flaxseed protocol for maximum immune protection. These 5 mechanisms, hormone balance through lignan activity, cancer starvation through angiogenesis inhibition, tissue regeneration through stem cell stimulation, DNA protection through enhanced repair, and immune reactivation through NK cell restoration, represent something extraordinary. They represent your body's innate capacity to defend itself, to heal itself, to regenerate itself, given the right nutritional information at the cellular level. They cost almost nothing. 2 pounds of organic flaxseed costs less than $10 and lasts a month. They require no prescription. They have no side effects other than better health, improved digestion from the fiber, and potentially better cardiovascular function from the omega-3s. And every single mechanism I have described has been studied by real researchers at real institutions whose references I have placed for you in the description below this video. I want to speak to you directly for a moment. If you are over 60 or 70 or 80, you may sometimes feel that the window for meaningful health change has closed, that the damage is done, the genetics are set, the trajectory is fixed. I want you to hear this clearly. The research says otherwise. It is never, and I mean never, too late to give your body better information through better food. Dorothy was 78 when she began. Eleanor was 76 post-stroke. Margaret was 69 after cancer treatment. Robert was 71 with rising PSA. Every single one of them experienced measurable, life-changing improvement. Your body, even at 75, even at 80, even at 85, retains a remarkable capacity to heal, to defend, and to regenerate when you give it what it needs. You deserve to have this information. Your independence matters. Your vitality matters. Your ability to be present for the people you love matters. The goal here is not just longer life. It is more vital life, more independent life, more mornings where you wake up feeling capable and strong and present. That is what this information can give you if you implement it consistently. If this video helped you today, please subscribe right now. It costs you nothing, and it means the world to this channel and to the community we are building here together. Share this video with someone you love, a spouse, a sibling, a friend who is over 60 and deserves to know about flaxseed. You could be giving them a gift they do not even know they need. Leave me a comment right now. Tell me your age and whether you have ever used flaxseed regularly. If you have, what benefits did you notice? If you have not, are you going to start after watching this video? This conversation belongs to you, and I will be right here reading what you write. Hit the notification bell so you never miss a new video. I publish evidence-based content for people in their 60s, 70s, and beyond every single week, completely free, and I want to make sure you see it. I am Dr. William Li, and I will see you in the next video. Take care of yourself. You are worth it. It is never too late.